Hello viewers, a beautiful afternoon to each and every one of you. Thank you so much for tuning in. I'm Ron Grant and you're watching 284 Media out of Tortola in the beautiful British Virgin Islands. World Mental Health Day will be observed on October 8th, while the actual day is October 10th. The aim is to highlight the mental well-being of all. Its purpose is, of course, to raise awareness and educate the public about mental illnesses, such as persons who suffer from depression, schizophrenia, and bipolar disorder. Now, the realities of living with these conditions as well, and strategies for attaining mental health and wellness. This year's theme is Mental Health in an Unequal World. Joining me to discuss the World Mental Health Day and its activities is Dr. Virginia Rubain. She is the Mental Health Director at the Mental Health Services, as well as consultant psychiatrist Dr. Torno at the BVI Mental Health Unit. It's a conversation that many people don't want to talk about, but we're touching it today, whether you like it or not. Stick with us after a word from our sponsors. You're watching 284 Media.
You value traditions.
Today,
You value music. You value education. Family.
I love you.
Service.
Thank you.
You're welcome.
Love. Life. At Popular, we're committed to you and everything our community values. For the things you value the most, count on us. Popular.
Viewers, welcome back. Thank you so much for sticking with us. Dr. Rubain and Dr. Turner, thank you so much for your time this afternoon, and welcome to 284 Media. Absolutely. I must commend you guys on always being present, always being willing to have the conversation with the general public, residents and friends. Mental health, as we know, is not a conversation that persons usually like to speak about, but as we traverse through these very difficult times, I think it continues to be more important. World Mental Health Day will be observed on October 8th, but the actual day is October 10th. Before we get into the conversation of the activities and what will be taking place, we know there's an amazing silly hat competition that many persons are already gearing up for. I want to touch on just where we are as a society at this present time. Of course, we are in the COVID-19 era. Both from your perspective, Dr. Rubain and Dr. Turno, what would you say is the present tone as it pertains to mental health awareness in the BVI as at present?
Well, Ron, I think that we're more aware than we've ever been before because we're all stressed. This has probably been the most stressful 2 years, and this is keeping in mind that we survived Maria. The constant uncertainty, the ever-changing landscape, the changing rules, waiting for cabinet papers to come out to tell us what's going to happen next. I think people are stressed and they're pretty much over the pandemic.
Dr. Turno?
I do agree with that. I think that the amount of uncertainties that we are facing right now with regards to future employment, finances, health, has all put a burden on everyone, which made them seek help. So now we're seeing a lot of people going to the clinics, asking for help with regards to their mental health, and are aware that they need to make some changes for them to be able to deal with these uncertainties that we face right now.
I am very happy to hear you say that persons are being more inclined, Dr. Turner, to come and seek help. I want to touch on the stigma that surrounds mental health. How are we doing as it pertains to just really letting persons know that it is okay to walk in their emotions and understand what's taking place with them? Dr. Rubain?
Well, I think people recognize now with the advent of social media, the stigmas that we historically acknowledged and adhered to, they really just don't exist anymore in terms of fear of confidentiality, fear of not getting employment. For those who are chronically mentally ill, they still face some of those issues. But for persons who are higher functioning, who may be struggling with depression and anxiety, there really are no barriers anymore for you to access services. The National Health Insurance has essentially given everyone access. And the theme for this year is equal access in the world. And we know that even in first world countries, people have difficulties accessing services. But here in the Virgin Islands, there is a plethora of clinicians to meet your unique needs. So while we could say that some persons with more visible types of illnesses may have challenges, I think for the everyday Joe, you really don't have a barrier anymore to seeking assistance.
And a reason for not seeking assistance, because as you said, it's become a lot easier as it pertains to the ease of health insurance and what have you. Beautiful. Let's talk about seeking help. What are the avenues at the mental health unit? What are available for persons who are interested in seeking someone to talk to or some assistance on whatever that may be going on with them?
Can I answer this one, or you want me to do it?
You can answer that.
Okay, so at Community Mental Health and Substance Abuse Services, we have a multidisciplinary team, and we work together very intricately to execute a treatment plan. So someone who requires services would call our numbers, 852-7675 or 541-2383. I think that's the correct number. Mm-hmm. And they would speak to a trained professional who would help to match them with the appropriate services based on the information that they present. And so we have been providing services in person and using telemedicine. So now a lot of persons on the Sister Islands can receive services because of the pandemic, we've had to evolve to telehealth.
Yes.
So substance abuse, depression, anxiety, schizophrenia, bipolar disorder, whatever it is that you may be challenged with, we have a team that is trained and able to deal with it. So just give us a call.
Indeed. Dr. Turno, I have to ask you, men and mental health. Culturally, unfortunately, we have been trained to just be strong and to show up and provide. And we rarely see much men coming to the forefront to not only rally for the cause, but to seek help themselves. As a man yourself, I want you to speak to the males in our community as it pertains to the mental health of a man and how, as a group, we can essentially promote a healthier lifestyles amongst ourselves.
I'm very glad that you asked that question, Ron. I don't think that it's limited to the British Virgin Islands alone.
True.
Generally, worldwide, men has lesser contact with mental health professionals as compared to women. But I've been here since 2013. I've noticed that there is a slight increase in the contacts from male patients to community mental health as well. Having said that, I still encourage everyone, especially the male population, to be more open into seeing and seeking help for their emotional well-being. I know that there is a status quo that men should be emotionally strong, but we have a new definition of strong now. It's not being able to cry, it's not being emotional, but being strong is being mentally well and mentally fit and physically fit.
Beautiful. The World Mental Health Day, as we mentioned, will be observed on October 8th, but the actual day is October 10th. Tell us about the events that we have planned for that day, Dr. Rubain.
So this year we're really taking into consideration our child and adolescent population.
Beautiful.
And just the whole idea that we all just need to have some fun. We just need to be silly. We need to laugh. We need to have a good time. And so we're having our Silly Hat celebration, and we're encouraging every single person in our community on the Sister Islands to make or buy your own silly hat. We've partnered with Clarence Thomas Home Center Limited, and they have imported hats, a variety of hats for persons to choose from. I was there yesterday. They're sold out, but they assured me a new shipment will be in on
Terrific.
Monday. Or you can go to Pinterest, my favorite place to surf, and you can select a pattern and have fun. It's therapeutic to make things. Make your own hat. The pictures that are uploaded to social media, so we're asking persons to take pictures of themselves in their silly hats, upload it to social media, and the person with the most likes wins a mystery prize. My staff hasn't told me what the mystery prize is. I suspect it's something really, really good. That's why they haven't told me, because I would want it for myself. So we're asking all the trust companies, all the banks, all the accounting agencies, all the government agencies. We have every school in the Virgin Islands participating. I am looking forward to a deluge of pictures because I want to see the community just, as we used to say, lively up themselves.
Indeed. And I'm loving the concept of a silly hat, just like you said. Sometimes we take ourselves just a little bit too serious. And I think this concept really helps us all to lighten up, smile, and relax a bit. As we close, Dr. Turno and Dr. Rubain, again, as we look holistically at this conversation, what would you each say we need to be paying more attention to in the Virgin Islands as it pertains to mental health?
I think just like how we check in with our physical health when we notice that something is off with us physically, we should introspect about our mental health as well. A tagline that I like to use all the time is, it's fashionable to be mentally well. We don't go outside unless our makeup is perfect and our hair is well coiffed and our clothes are well ironed. The same attention should be put into your mental and physical health. So if you get up and you're feeling blue and you notice you've been feeling blue for the past 2 weeks, it doesn't hurt to give us a call and say, hey, I've been down for these past 2 weeks. It may be nothing, it may be something. I'm just checking in, because it's fashionable to be mentally well.
Dr. Turner, what should we be paying more attention to?
Yes, I would encourage everyone to be more mindful of themselves, to love yourselves more, to accept that there isn't a perfect world that we're living in right now, and we're in a pandemic, and things can get stressful. You may see yourself not feeling well one day, but remind yourself that you can pick yourself up, and always remember to choose gratefulness and choose positivity over the other negative thoughts that you have. And if that doesn't work, then you have the mental health team to assist you in all the other things. And we are always ready to help you.
Amazing. Viewers, while listening to Dr. Turno and Dr. Rubain, I must interject and remind you that we must be aware of our triggers. We must be aware of traumas in our lives that may have caused such feelings, and most importantly, successful methods of really taking care of yourselves and coping mechanisms as it pertains to mental health and mental well-being in general. Triggers, trauma, and coping mechanisms. Remember those 3 terms, and we will be in a better position to live a healthier and a much more productive mental health life. Thank you guys so much for coming into the studios. Viewers, that is all the time we have, but of course that is not all the content. Be sure to tune in at 6 p.m. where my colleague Kamal Haynes and I will be bringing you the latest in local, regional, and of course international content. A happy Friday to each and every one of you. Thank you so much for your time. Bye-bye.